I think the principles of enabling people fit with each of the 5 principles of prudent healthcare. For me, as an occupational therapist, my whole professional practice is around making sure that I work with someone to achieve their goals, to find really practical ways of enabling them to leave healthcare services behind and live independently. And that fits with how we work. Reablement is very much about looking at what the person needs to do, finding a practical way to overcome it, and helping people to learn to manage their conditions in the long term. Not an expectation that we're going to take control as professionals, get rid of that condition, and you don't have to do anything but be passive. It requires people to be active, in control, to have a voice and to share in the decision making. And I think for us that's very much what the principles of prudent healthcare are around. The main messages of the chapter are about how NHS Wales, working with social care partners, needs to really focus on services that enable reablement and recovery and that focus on rehabilitation, so that we really ensure people are able to reach their fullest potential and maximise their recovery. If we look at reablement services, 70% of people need no ongoing care after they've had a period of reablement. So it has a huge benefit for people. And as a workforce, health and social care professionals really need to start listening to the person and making sure that we really do what needs to be done and what will be effective in helping people to meet their own goals to live their lives independently. I think people will be really surprised that there is such inherent harm in doing services to people that make them very dependent on long-term care and support. We have a real tendency to look after people, to wrap care around them and make sure that they are safe and protected. And what that does is actually disable and disempower people. Reablement and recovery and rehabilitation services are very much about giving that control back to people, so that we are not creating long-term harm by taking away people's independence and capacity. Successful prudent healthcare will be when no one is receiving a service that is greater than they really need, so that we are only doing what needs to be done to enable them to recover. You will no longer see a label being applied to someone's problem and some kind of treadmill or pathway applied regardless of that individual's personal situation, but that actually that person has a very personalised programme which fits with them and what they need to achieve and what the real problems are for them as an individual. Then I think we'll have a truly prudent health and social care system.